Hello, everyone. Happy Thursday, and welcome to the next edition of the Laser Skin Surgery Center webinar. Today, we are honored to be speaking with Dr. Ron Shelton. And while you are all getting acclimated here and signing on, I just wanted to show you a little bit about the functionalities today. So on the bottom of your screen, there is an option for QA and there's an option for chat. The QA is the ideal place for you to start placing your questions. You may start now, or you may have them throughout Dr. Shelton's presentation. He has a very educational presentation planned for you, so I imagine there will be a lot of questions, and we will stay on as late as possible to answer as many as we can. So while the last few of you are coming in, let me go ahead and introduce our esteemed speaker today. So Dr. Ron Shelton is a board-certified dermatologist. He originally actually started the derm surgery program at Mount Sinai back in 1993. Then he went into his own private practice and opened one of the first medical spas on the Upper East Side. And in 2014, he joined the Laser and Skin Surgery Center, and we are very lucky to have him. At Laser Skin Surgery Center, he focuses almost exclusively on cosmetic dermatology and the treatment of skin cancer, including Mohs surgery. But today, we are very excited for his topic because he is going to be speaking about non-surgical facelifts and neck lifts. So I'm sure all of us, especially this COVID era with all these Zoom calls, we're all always looking how to tighten a little bit. And although we are not against plastic surgery, we actually have two esteemed plastic surgeons in our clinic, a lot of people would prefer a non-surgical alternative first. So Dr. Shelton is going to be focusing on all of the technology and techniques available to tighten your face and neck without surgery today. So with that in mind, I am going to introduce you to Dr. Shelton, and then we have a little poll to run to kind of get an assessment for where everyone is at before he begins. So welcome, Dr. Shelton.
Hi, Risa. Thank you so much for letting me present this evening. It's really a great honor to be practicing at the Laser and Skin Surgery Center of New York, where we have greater than 100 lasers and devices to individualize our treatment for each patient. And yes, I would like to discuss tonight how we can tighten one's sagging skin of the face and neck without necessarily making someone undergo the knife.
Perfect. So I'm going to launch a little poll right now, and you guys should all have something that came up on your screen. And the question is, do you feel you are a good candidate for a facelift, but not ready for surgery yet? So I'll just give you guys a couple seconds to vote. It is totally anonymous, so we can't see who's saying what. And this is just for Dr. Shelton to have a little bit of a better idea of who he's speaking with. All right, 5 more seconds if anyone else wants to get in their vote, and make sure you press submit. All right, I'm going to end the poll, and I am going to share the results.
That's significant.
Yes.
Great.
All right, so with that in mind, Dr. Shelton, I see your presentation, and we are ready to go.
Great. Thank you, Risa. Just taking a few seconds for the presentation to launch.
And while that's happening, again, at the bottom of your screen is a Q&A. So any questions that you already know you have about non-surgical facelifts or neck lifts, you're welcome to start entering them there. And Gita, thank you for, she says, great to see you, Dr. Shelton. It's Gita from Miami, from the Four Seasons Hotel.
Gita is a fantastic esthetician and had practiced with me in my former practice. Hi, Gita. So, yes, facelifts are not for everyone, as my patients tell me, and certainly they are certainly fine treatments for the same people maybe later in their life, but there's some people who have medical conditions that preclude them from having surgery. It may be a cost factor. It may be that they want to delay it for a few more years. They don't have the downtime to recover. And there is a big fear of looking unnatural. And that is why it's important if you're having a facelift that you see not only a board certified plastic surgeon, but someone who you can trust based on reviews and word of mouth and seeing results in maybe friends and others where these people do look natural. And both Dr. Hoffman and Dr. Brown here at our practice do beautiful facelifts. But again, for those patients who are not ready for a facelift, how can we approach this? How can we improve our sagging skin? Well, why do we sag? Mostly because we've lost our elasticity. We've lost that property that allows skin to stretch and come back into its normal position. We've lost some of our collagen protein. That's the building block or structure, the infrastructure of the dermis below the epidermis of the skin. That's mostly caused not by age, but by sun exposure and smoking, as well as heavy alcohol intake, other diseases. But there have been great studies, twins that have grown up, of course, of the same age, one looking extremely photo damaged, very wrinkled, and the other not, depending on their life, how they lived it, and sun protection. In addition, we lose fat, the fat underneath muscle above the bone of our skull that provides shape. We actually lose bone. We thin out the convex shape of the bone, of the cheekbone, our chin, our temples sink in, and with that, we sink, we sag. In addition, we get wrinkles, and we get the brown liver spots, sunspots, and other rough spots. So we know facelifts lift the most, but what can we do with non-surgical means? Well, before we treat the skin, we'd like the skin to be under the best condition. Prior to procedures, if you are a smoker, shame on you, but you should try to stop for the 2 weeks prior. And we want to improve our collagen and elastin. And even if you're not ready for a non-surgical treatment, you could start these creams that have been proven to improve the collagen and elastin. It's just like seeing the dentist, but then in between visits, using your fluoride in your toothpaste. So we want to provide more support. We can do that with fillers. We want to pull up sagging skin. We can do that with threadlifts. And we can dissolve bulky fat that might be weighing down certain facial features by injecting Kybella. We'll show that later. And Botox can relax the downward pulling forces of certain muscles to help the other muscles that naturally elevate the face work better. So in terms of the collagen, supporting fibers we mentioned, the elastin, the spring back or elasticity, and the old damage, the old sun damaged collagen protein losing its tightness and the elastin losing its spring back. These are very important principles. We have to address them. The loss of bone and fat. We mentioned that the loss of volume will make us not look as young anymore. We lose our rounded convex features. Once we start to lose that convex surface, light now doesn't reflect as well off the face. It looks a little bit dark, and dark makes us think of shadow, which makes us think of a deeper depression. As we lose a lot of fat, we can look skeletonized. The skull almost looks transparent through the skin. And the loss of the apple of the cheek can deflate the rest of the face. And when you look at many of the glamour magazines on the cover with the photoshopped images, there's usually a brightness conveyed to the apple of the cheek to make it look more prominent. The bony structure of the mouth, the chin can recede, the gum line, etc., and that all changes the shape. The jawline also changes, and the skin starts to sag more because of it. So look at a person, this is not the same person, it's not my patient, but let's take an obese male here, and let's pretend that he lost a lot of weight. Well, where is the skin going to go? The skin is going to fall like a loop because the skin is of the same distance, but now that same distance has to go somewhere. So that is not unlike the cheek. If this is the bone right here, and this is your muscle, then we have muscle over here and a thin layer of fat between the skin. But the deep fat over here will recede as we get older. See how much thinner it is here versus here. And the same thing happens. Now the skin is of the same length and perimeter as it was when we had an apple of a cheek, but when the fat deflates, the skin sags, forming the jowl. So a youthful face, deflation of the apple of the cheek, the vector pulls down, and now we get this hanging skin called the jowl. We get a deeper pad here of the cheek, forming the smile crease. So what do we do to make this better? Well, Retin-A, brand name of the tretinoin and retinols, can improve collagen. Many other topicals, including vitamin C, vitamin E, have been shown to make some improvements. But there's also now newer creams, cosmeceuticals, elastin, and others like Skin Better Science that can improve the removal of damaged elastic fibers. From sunshine, nice thin elastic fibers have crumpled and no longer elastic. We want to get rid of that and start having our cells make new elastin as well as new collagen. We can do that with medium and deep chemical peels. Superficial lunchtime peels, we really don't get much of an improvement in the infrastructure. Microneedling. Microneedling not at home because the depth of that is too shallow to penetrate into the dermis. But in the doctor's office, microneedling can effect improved collagen and improved elastin. Heat, whether generated by ultrasound energy or radio frequency, can improve our collagen production, as well as laser resurfacing. So we know that heat, bringing the dermal temperature up into the low 40s of centigrade, can induce new collagen. There are treatments such as Pelave and ThermiSmooth, which are external radio frequency devices. There's the newer from InMode Evoke, Forma. Now we get into a little bit more penetrating, a little more painful, whereas the first line of treatments, some people describe as painless or a hot stone massage. Thermage, deep radio frequency, and Ultherapy, which is deep focused ultrasound, not the ultrasound that we use for diagnostic reasons, but therapeutic, and that can hurt. Both Thermage, radiofrequency, and Ultherapy ultrasound do hurt. We give our patients medication to make it definitely more palatable. Microneedling is combined with radiofrequency in several devices on the market. We at our center prefer to use the insulated needles, and Lutronic has both the Genius and the former Infinite devices. So the needles go down, creating the microneedling trauma to induce collagen, and in addition, the radiofrequency energy to heat up the dermis. If we're lifting, we want to go deep on top of the bone underneath the muscle for the mid-cheek, near the apple of the cheek, the cheekbone. And we often use things such as Voluma, Restylane Lift, Radiesse, and even fat injections. We can lift, as mentioned earlier, with threadless. Threadless were designed many years ago with permanent sutures, but soon that was abandoned because the results at 1 year with that technique was virtually no different than in the beginning. With dissolving sutures, not only do you have an anchoring support, but you're inducing new collagen of yours as that dissolving suture dissolves. So you're lifting and producing collagen, and the average results of longevity are about 1.5 years, maybe 2 years with those sutures. And we'll show a little bit about that later. It takes about 1 hour to 1.5 hours. People might call it a lunchtime procedure, but there is some swelling, bruising, so it's really not a true lunchtime procedure. Fat reduction of the infamous double chin, the turkey neck. We use bile salts in our intestines to dissolve fat. The bile salt has been removed, purified, and we then inject it into the fat of the skin underneath the neck to get a tighter angle. Cool Mini is the applicator of the freezing device called Cool Sculpt. And we use Cool Sculpting on many different body parts, commonly the abdomen, the love handles, and the flanks, thighs, because it was found that freezing the fat causes injury. Skin doesn't freeze at that temperature, so it's preserved, and then the body mounts an inflammatory response to get rid of some of that fat. So now we can do that as well underneath the chin to decrease the turkey neck. It has been done with sculpture, which is a laser to produce heat. It is done in a minimally invasive procedure, not non-invasive, with Thermite and liposuction, or Thermite without liposuction. And you can have liposuction without Thermite. And there are other devices such as AccuTite, FaceTite, that can do the same thing. So realistically, I am not going to recommend the procedures that I have just discussed for someone who has significant jowling, significant what we call submental fat, and maybe loosening of the muscle bands here, because they're not going to get enough improvement. I've been wrong, and there's a slide to show it later, but we recommend, based on what we think is the greater average number of patients, the kind of results they're going to have, and if we can't predict a very good chance of a good result, we'd rather not do the procedure. And I usually say to my patients at that point, save the money you would spend with me and put it as a down payment towards your facelift. But again, there are people that are not candidates for these procedures, but are still willing to gain a little improvement because they can't or won't undergo the knife. So what's projuvenation? If we're not discussing rejuvenation, it's to stay ahead of the curve. We know that there are people out there that look at their spitting image of their mother or father when they look at pictures of the parent when they were younger, and they don't like the bags under the eyes, they don't like the double chin, they don't like the jowls. So they might want to start ahead of schedule to build up their collagen, get rid of the sun damage. But many of us out there have done the wrong thing and sunbathe, and that cooked us. That's radiation damage, our skin is shot. Let's start projuvenating the skin. And if you're going to have a treatment, this is going to help you get a better result and maybe heal faster. So what we see in projuvenation is the slight sagging, maybe just a little bit near the jowl, maybe starting to have the deeper smile folds, the corner of the mouth dropping down a little bit, and that jowl coming down. So again, it's very important that we personalize our treatment, that we can sometimes combine these treatments. We can use energy devices and fillers. We can lift with fillers, energy and lifting, fillers lifting energy, energy lifting fillers, Botox, jowl, neck, fat reduction. Doesn't mean they're all done at the same time. And there can be problems if two things are done sometimes together. So we work out the treatment plan. Maybe do Botox first to relax the cooling down effect. Then maybe do a heating device, and then maybe do a filler. So Risa, I think you have a survey.
Absolutely. Coming right up. So everyone, there is one more survey that should pop up on your screen right now. Have you ever heard of dermatite laser? So have you ever heard of dermatite laser? Yes, not sure, or no? All right, I think enough of you have voted. One more second. All right. Let's see. All right, here you go, Dr. Shelton.
Well, this is great because there is no such thing as dermatite laser. We want to make sure that you know that there's a lot of branding out there, and one practice may call something by one name. It may be tried and true or it may not be tried and true. So please do consult with board-certified dermatologists and plastic surgeons. And don't just shop around for price, because the way procedures are done could be very different. Is it the provider doing it, as we do here in our center, or is it a paraprofessional, a physician extender that's doing the treatment? All right, let's move on. This is our first authentic silhouette Instalift survey. Do you know of thread lifts by this name, silhouette Instalift?
Yeah, so this one is not a trick question. Have you ever heard of thread lifts or silhouette Instalift? Let's do a few more seconds here. All right, I will end this poll. Here we go, Dr. Shelton.
Right, so majority of people have certainly heard of it, and suture lifts have been done, as I mentioned earlier, differently, but now with absorbable sutures, they produce more collagen. It is a rather straightforward procedure. It usually takes an hour, maybe an hour and a half. I'm just having a little technical difficulty advancing this slide, so please be patient. It does use local anesthetic, so the pain factor is minimal. There can be some times where it's a little more uncomfortable, but people are awake during the procedure.
Great, so a couple of you have entered some Q&A, and I just want to remind you that as he's going through, Dr. Shelton has a lot of educational material here, so I encourage you not to wait until the end to answer your questions. To enter your questions, you can start entering them now as he's going through each of the treatment options for the non-surgical face and neck lift.
What we see here with the Instalift is this is a cone and this is a knot. The whole suture is dissolvable, as well as the knots and the cones, and the cone is what anchors the suture. There are some graphic images, so those who are faint of heart, you might want to look away.
What is it about your face? What is it that you want to see improve? I would like this area to go up. Have you had anything done before to try to give you a little bit without surgery? Yes. The therapy. Yeah. And you saw some improvement? Yes. But you want to get a little more improvement? Yes. If we can, Instalift. Very good.
So these are the knots here. After local anesthetic, we're introducing the needle with the suture from the midpoint right here, and then it will exit out here. And with the cones, we pull up and it lifts up the smile.
Happy?
Very, thank you. I cannot thank you enough. I don't know what to say. It lifts me up. It's really like, it's not like I'm not drooping. It's like, it's even less than going to the dentist. Really, it was a great experience. I'm happy I decided to have this procedure. I'm really happy.
So there we have before and afters, and that's only 2 weeks after the procedure. What we see here is the smile fold is less deep. This marionette curve is less deep, and we have a softening of this whole area. The jawline, where we have a minimal jowl, has been lifted and straighter, and as we lift, we're repositioning some of the soft tissue underneath the epidermis into the cheek, giving a more full cheek. Similarly, from a bowed angle of the mandible or jawline, we have a straighter jawline. And again, where we have significant hollowness, we're repositioning that tissue. All right, let's do the survey, Risa, on Ultherapy.
Oh, I was on mute. Okay, here is the survey on Ultherapy. Have you heard of Ultherapy or Ulthera?
Before I mentioned.
Yes, before today, before the explanation of this webinar. Okay, everyone answered pretty quickly, so here we go.
That's a great presence. Wonderful. Let's see. Unfortunately, we have several seconds of a delay after we do the survey, so please bear with us. Thank you.
And someone asked about seeing before and after photos, and I will tell you that we have a number of before and after photos a little later in Dr. Shelton's presentation. So yes, he will be getting to those.
Promise?
If the slide wants to progress, we will, which we will get there.
So let's talk a little bit about Ultherapy. We mentioned that it is a deep, high-focused ultrasound energy that is painful. Okay? People are rarely put to sleep for it. It is something that we're able to make palatable. We usually give some pills for pain. And we also have nitrous oxide, laughing gas, which helps allay that concern. It is done on the skin. There are no needles. The transducer of the ultrasound device is applied to the skin with a gel. And the advantage with this device is that we have a monitor to show us actually where we are in depth. We're able to treat that plane of skin. We're looking for connective tissue that's locked together, and we want to make that tighter. And they're in different planes. So we have different transducers in different depths to affect the improvement we're trying to get. And we're still not advancing research.
That's so strange. Maybe worst case if you reopen it.
It's not even allowing me to escape from it.
In the meantime, one person asked, are you presenting the options in the order you would recommend them for best results?
No, because it does vary on every patient I see. So this is the transducer over here with the ultrasound gel, and look at the white band, that's the superficial dermis, that's what we're targeting, as well as the deeper fascia right here, this little white scattered line, that's a deeper fascia, that's connective tissue. We're down with energy to heat it and have it contract. It is what we call colorblind, so skin of color, dark skin, we don't tend to get that risk of post-inflammatory hyperpigmentation that can occur with some devices. The improvement with Ultherapy is only in about 6 to 12 months. You might see it even at 2 or 3 months, but the peak improvement, and I will repeat usually at a year if needed, very rarely at 6 months, but I have, but certainly not monthly. The downtime is minimal. When I'm treating the right cheek, it turns red, and as soon as I go over to the left cheek and finish on the left, the right is hardly red for most people. Of course, there are going to be some who are going to be more swollen, more red, so you always want to give yourself downtime of maybe a couple of days just in case, and very rarely is there bruising. It does happen. I've seen one case, I know a physician saw a case. So these are some before and afters of Ultherapy. Again, much improvement in the smile fold here, much softer, as well as taking the cheek and bringing it up into the mid-face instead of having it hang on the jawline. So this woman has a very prominent jowl, a pretty moderate marionette fold and the smile fold. The smile fold hasn't changed anything with Ultherapy, but there's definite improvement in the marionette line and definitely a more straight jawline. And on men, whereas the bearded skin is thicker and a little more resilient to these external treatments, we do see improvement where this angle is rather obtuse and becomes more acute or sharp. If we work with Ultherapy on the forehead above the eyebrow, we can improve the tightness, which will help pull up the arch of the eyebrow as well as the eyelid skin. But this patient also had Thermage, the external radiofrequency. I cannot do Ultherapy, ultrasound, on this area, but we do radiofrequency on this area. So we see from 2.5 to 3 millimeters of the upper eyelid exposed. We now have double or almost triple that with this patient. Not everyone gets the same good improvement. There are some rare cases where we don't see any improvement. So we're showing here a template application, Thermage on the eyelids, change the tip, and do Thermage on the forehead. And that's the redness, typically with Ultherapy or Thermage. This is just showing that these devices can be used on the body. That would be another webinar topic. And we're measuring the temperature to show some elevation. So on the body, I find for me that Thermage is more efficient. It's a wider handpiece, if you will, whereas the Ultherapy or a newer device called Softwave might take longer to do, although Softwave is indicating that it takes less time, but it's new on the block and we have to give it time. So here we see a little bit of this hooding, as we call it, and now we have a greater distance of exposed eyelid skin as the skin comes up. Again, plastic surgery, blepharoplasty eyelid surgery would do a far better job, but if somebody doesn't want that downtime, Thermage might be the answer. Smooth, external radiofrequency, non-painful. We call it a hot stone massage. We're checking skin temperature here, seeing the skin temperature in centigrade, and a FLIR camera infrared showing where the white spots or the hot spots are. So with this treatment, we do it every week to every 2 weeks for about 5 or 6 times, and the downtime is non-existent. Again, it is something that we consider colorblind, so it's safe on all skin types. This was Pelave comparable to Smooth, and we see with just that non-painful series of treatments, the softening of these folds with significant softening of the smile folds here, and even the jawline when you compare the jowl. Not everyone gets such good improvement in Smooth. And the frontal view on the same patient, whereas we have some dimpling here, that's improved from the tightness. So we have a survey now for Thermite.
Actually, let's skip this survey.
Okay. Thermite. Again, more graphic images. So please, if you're somewhat faint, don't look.
The areas that you're interested in.
I'm interested in tightening my jawline and also my neck. It's beginning to sag and droop more than I like it. Yep.
So we're using a cannula here after local anesthetic. The neck is numb and she's feeling no pain. FLIR camera showing how hot we're getting the skin. No general anesthesia. And we're heating to dissolve fat as well as tighten the skin and produce more collagen. And here are the results. So jowl, a hanging neck, and this is at 18 weeks. Her recovery, she's swollen. She wasn't bruised, but she was swollen, and we usually use a compression garment for that first week. So it's not no downtime. This is a minimally invasive procedure, but there's no cutting. The insertion is through a needle hole. One here, possibly one here on each side, but not a long incision and long scar. And here's her other profile. So this is a very good result with Thermite, and I would not indicate to any prospective patient that this is what they should expect. It's what we'd like to achieve. We don't always. We'd like to get 50% of this. We'd be happy. And just here's another patient showing a slightly sharper jawline after the procedure. Now, the jowl that you have down here with laser resurfacing has not improved at all. With laser resurfacing in some patients, depending on age and history of sun damage, we can improve that texture significantly, but we may not get the lifting that we want. Here's the other profile. Again, this jowl is unchanged, but the texture is so much better. This is similarly Fraxel carbon dioxide laser resurfacing, fractional, so it's minimally to mildly ablative, not fully ablative. That means there are tiny little dots of the laser going through to allow the skin to heal in between those dots much more quickly than if it were what we call fully ablative. So here she is at 2 weeks, healed, but this is definitely not a no downtime procedure. You're swollen the first day or two, it's oozing. You can scare people if you just meet them at that front door without giving them fair warning. But we come in, we do some oxygen facials, we have the right topicals to apply and compresses, and it's not a painful post-operative recovery. But for a solid 7 to 12 days, you're dealing with this. For the most part, a week. So again, the jowls have made a straighter jawline and significant improvement in this smoker. Plasma is a different source of energy than laser. It's called the fourth phase of matter, and we are getting improvement in texture as well as tightening. This is definitely not a procedure that I would have recommended to improve this part of the neck. We were hoping to get improvement of the marionette fold, which we have slightly, but her neck actually did far better than I thought it would with plasma resurfacing. Here's another patient. The jowl, really not much different. The muscle neck bands, as I'm indicating here, have not improved, but we do have some tightening of the skin and definitely resurfacing of the texture of the skin and some tightening for sure. So plasma resurfacing was done for several years. I did enjoy it. My patients got good improvement. But the company left the market, and now there's a new company a couple of decades later that has a similar new and improved device, but we don't have enough information yet to determine if it's something that we will be doing. Fillers. Lisa, are we doing a survey?
We are. Okay, everyone. Here you go. Have you had injectables or dermal fillers in the past? Yes, regularly. You're real good about it. Yes, occasionally. Yes, you've tried them. Or no, you have not dabbled yet. All right. 5 or 6 more seconds. I see a lot of people still answering. Okay. Interesting.
So a lot of people have not had it frequently, and that's very interesting because, again, fillers can help lift sagging skin. You know, when we have a grape that dries out in the sun, it shrivels and forms wrinkles, meaning a raisin. If we make the raisin back into a grape, we're distending the structure, we're making it rounder, we're filling it up and actually tightening the skin because the skin has to stretch outwardly again. When we lose the fat underneath the muscle, above the bone, the skin sags, as I showed previously. So I just would like to show a few slides of the results of fillers. Notice I said I'd like to because it's still not advancing. So you've all been very patient. It's been 45 minutes. Hang in there. I certainly hope this is worthwhile for you to endure such a long evening with me.
Well, we have a lot of questions already, so I think everyone's really enjoying this. A lot of questions coming in. So I guess while we're waiting for this to load, I think this might be a good one to address. Someone's saying, are any of these treatments okay for someone older, like in their 80s or 65 plus?
What was the last thing you said?
Well, one person said, is it effective for 65 plus? And someone else said, is it okay for someone in their 80s?
Yes, I actually have several patients currently that are in their 80s that I treat. And over my 28 years of practice, I have definitely treated the elderly population. You know, in fact, you really have to weigh everything about that patient, their history, their medical condition, their quality of life. There are people who are not good candidates, as they said, for surgery. I've had breast cancer patients undergoing treatment with chemo, and they wanted to feel a pick-me-up. They're looking at their face every day, and it's just a reminder of how sickly they are. And filler, in particular patients, with the approval of their doctors, can really help their psyche. So yes, now do we expect the same great benefit in an 85-year-old as we would with a 20-year-old? Of course, a 20-year-old won't need much. Let's say a 30 or 40-year-old. No, obviously not. And in addition, I am very cost conscious for my patients. I don't want to have to inject 4, 5, 6, 7 syringes of filler for an 85-year-old to get even the same benefit that someone in their late 40s or early 50s would develop. So that is definitely a factor. But yes, elderly population, don't stay away. Come and meet with me and we can discuss what we can do to help. Speaking about help, can we advance the slide?
Well, while we are waiting for that, how about another question? What is the average age that a woman considers a facelift?
Well, I would ask my plastic surgeons to comment on that, but I would say typically it's in the late 50s, early 60s.
Okay, and here's another good one. If someone consults with you to do can you do some of these treatments same day or next day if they happen to come see you from out of town?
Yes, there are ways of doing that. You know, with many of these procedures, we want to make sure that our patients are not taking blood thinners because of the bruising phenomenon. So we mentioned, please withhold any aspirin for 10 days. The non-steroidal anti-inflammatory agents such as Aleve, Motrin, ibuprofen, stay away from that for 3 days. Stay away from vitamin E supplements, fish oil, and there are a few other things. Again, if you're a smoker, please really cut it out prior to coming in. But there are factors, including the length of travel, how people are traveling, and the type of treatment where we may not want them to leave that same day to go back home, especially if they're flying. Lisa, I think that I should stop sharing and try to get back to my presentation, and then I can join back. Is that all right?
Yep, that sounds good. So while he is doing that, someone else asked, will Dr. Lloyd Hoffman be doing a lecture in this series? And the answer is we do not have a date secured yet, but yes, we definitely plan to have him do a lecture in this series. We are very excited to have Dr. Hoffman as part of our team. So I'm happy that it sounds like maybe one of his patients is tuned in. Our next couple ones up are with Dr. Belkin next week on body contouring and the sculptor butt lift. So that's next up. And let's see. So we are back on. Is it moving now, Dr. Shelton?
Yes, it is.
Perfect. All right.
Definitely, unfortunately, part of the survey and changing formats. In any event, so we have a young individual who has some deflation of the cheek right over here. as well as some sun exposure, which has contributed to the wrinkling. And this is not laser. This is filler. So whereas we have some jowl with filler, deep filler, voluma, above the bone, under the muscle, we're getting a straighter jawline. We're getting the convex apple of the cheek. We don't have the shadow. We have a brilliance. We have this rejuvenation. Similarly, even a younger individual who felt that they were recently feeling this heaviness right here. It looks like an oblong oval because we are deflation. We are deflating here in the mid-cheek. So with some deep voluma, we can give back that apple of the cheek and improve that sagging that we noticed here. This is just the same patient, but a profile showing even improvement in the neck by treating along the jawline. And yet even a younger individual with some deflation over here, some hollowness, and just the right amount. We don't want to overfill. I don't believe in anyone looking unnatural. If someone wants to overfill, I actually turn them away. So subtle is better. And again, you see a little darkness here, but you see some brilliance here. The light is just bouncing off this cheek, off that convex rounded apple of the cheek. Now, there are people who are born with a recessed chin. The jaw is not as round, and that changes the angle of the neck. And if we build out the chin, we get a better angle of the neck. A jawline, this gentleman wanted a sharper jawline. I apologize that it's out of focus, but here with some deep voluma, we're building this squared angle and a sharper jawline. And then with certain fillers that are really not designed to lift the whole face, we can soften those folds to make the impression that she wasn't sagging. Yep. So we have muscles that are pulling up, but we have muscles that are pulling down. If we make the muscles that pull down relaxed, then the antagonistic pull of the upward cheek muscles may help the jawline. So here we have it, some neck muscles pulling down, creating that corner of the mouth. And if we do Botox in these areas, we can help lift that corner and make a sharper jawline. We mentioned earlier the bile salts that dissolve fat from the gallbladder, leak into the intestine, therefore dissolve fat that we're eating. That same bile salt, one of the two, has been purified, and Kybella is injected. So let's look at a video of a template, a little grid being applied, and then we follow the dots with the Kybella injections. I usually do apply numbing cream to the skin for my patients about a half hour prior to doing this. Not every doctor does, and not every patient wants it. But even though the needles don't hurt much, and this is a very tiny needle, there is a burning sensation with Kybella about 10 minutes later as it starts to work. And the thing with Kybella is that we do it every 6 weeks approximately. And typically it's 3 treatments for a woman with thinner skin and up to 6 treatments for a male with thick bearded skin. There can be bruising because it's a needle, but everyone that has Kybella gets some swelling. And I call it the jello jiggle because when you shake your head, the neck jiggles like jello. So here's the before. You can see the submental fat, as we call it, with significant improvement and a sharper chin line. You'll see it better on this profile. So this is not surgery, this is not energy, not laser, just Kybella injections. And that's her other profile. Much improved. We have a little micronathia, as we call the chin reduction. She could have benefited with some filler to make a sharper angle, but with just Kybella, we do have some flattening. Is it as ideal as a neck lift? Absolutely not. The plastic surgeons can do better than this. I can do better than this with Thermite that we mentioned before, but there's that significant downtime compared to Cacao. So there you have it. We are ready for questions and answers, Lisa.
Fabulous. Thank you so much. So we have a lot of questions lined up, but while we do that, we're not going to leave this screen up forever. So I would encourage you all to write down any of the information or take a screenshot. We would love, Dr. Shelton is available for both virtual and in-person consultations and treatments in our New York City office. We do have patients that come in from all over the country and all over the world. So I know a lot of you today might not be local, but he's definitely still available for providing his expertise, and he is great to follow on Instagram, as is the practice handles. So let's get into it. All right, let's start off with an easy one. How long do the benefits of Ultherapy last? And how long do the benefits of Thermage last?
Well, I think that the facial results with Thermage have the same longevity as that with Ultherapy. And it's usually between a year and 2.
Great. All right. What is the best treatment for eyelids?
Surgery. But when we're not ready for surgery, or there's not enough pudding, as we say, then I prefer Thermage. Again, I can't physically perform Ultherapy on the eyelids. The energy is too dangerous for the thin eyelid, and the applicator is bulky. With Thermage, we have small tips, and the radio frequency for that small tip is designed for the eyelid.
Okay.
But there's also fractional resurfacing, carbon dioxide laser, and when the pudding is more than that, I would expect Thermage to help, then a fractional carbon dioxide or erbium laser, the Cyton profractional contour laser as an example.
Does lymphatic drainage facial massage help slow down sagging in the face, particularly around the jawline?
I'm not sure. I've not really read any good medical study that's double-blind, placebo-controlled, as we call it, in peer-reviewed journals. I will say that lymphatic massage can definitely make temporarily someone have less of a sagging appearance if their sagging is related to edema, swelling, salt, water retention, thyroid conditions, things such as that.
Okay, this one's a little bit of a loaded question, but I think it's relevant. How do we figure out who in your practice to see for a consultation?
Well, sometimes that depends on the experience of the physician. Again, word of mouth is so darn important, but many of us don't have that opportunity because you don't know anyone that went through the procedure. In today's time, patient reviews online are very important. I think it does, not always, but very often, give you the message as to how the physician is thorough. You, of course, want to make sure that the physician is board certified. Here within the practice, I have to say I am privileged to work with such a family of expert physicians who are ethical. And the physicians whose forte is not to do procedure X just let the staff know, and those patients are not scheduled with that physician. If a physician feels seeing a patient, as I do when I see a patient, that there is another physician in the practice that can do a better job for that particular condition, I tell them.
Yeah, so it's definitely one of the benefits of coming to a large group practice is we definitely have someone for everything. Let's see. Could you please tell us about microcoring? What were the results like in the studies? Most procedures are hit and miss. Does this one seem to work on everyone?
Well, I can't divulge the studies right now of microcoring since it's not fully FDA approved, I believe. But it works by having a little specimen of the skin removed. So it's like microneedling, but different. We're creating trauma with both to induce more collagen response, but the microcoring is actually removing a tiny, tiny sliver of a core of skin, which apparently does not cause any surface change, but helps induce collagen. So I think you need to stay tuned to find out if we can compare these results.
Okay. Can laser treatments be done after having a thread lift? Thread lifts are put in, or will they affect the effectiveness of the threads? And should fillers be used in conjunction with a thread lift?
I often do insert fillers in conjunction with thread lifts. I like to do the thread lifts if possible first and not the same day as fillers. What was the first part of that question?
And can you have a laser treatment after you have threads put in?
Absolutely. The laser does not penetrate as deeply as the plane in which the thread is placed.
Great. Are there any chemical peels, medium or deep chemical peels that you recommend? Do you feel the Jesner peel or the Perfect Derma peel provide results?
The Jesner peel is a superficial peel. So as I mentioned in one of the early slides, it's not going to do much for dermal collagen production or tightening. You know, in studies that show with biopsies and improved collagen production, it's not the same as having a clinical effect. We want to look at a clinical endpoint, not a laboratory endpoint. So you need to go towards a medium depth chemical peel, which really has a week of downtime. There are so few doctors in the United States that are doing a deep chemical peel anymore, because the true deep chemical peel was with a chemical that would guaranteed lighten the skin color. There was some risk of cardiac toxicity. It has to be done in a regimented time fashion, 15 minutes per quadrant of the face. And with the change in color, many people weren't happy with that. I would say in my training, I've seen lots of great results, and I had done deep chemical peels, and the smoothness was incredible. But it does leave sometimes a transparent skin, and you have to trade off by definitely using makeup to kind of hide that coloration of the skin. Medium peels might be great in conjunction with some of the treatments that we've mentioned, but they're not going to produce as much improvement as these heating devices, even the hot stone massages like Thermage.
All right, so this is a really good question. So what factors play a role when you choose which device is best to use on the face?
So I need to see how much skin there is that I'm trying to lift. What condition is that person's skin in? Different devices have different risk factors. If the person's skin, I'm concerned, might be at greater risk of injury and not healing well, I'm not going to use an aggressive energy. Coloration. Are they at greater risk of this post-inflammatory hyperpigmentation? Again, in other words, darkening of their skin, their innate pigment getting darker as a result of trauma. We have to consider all these factors to know which is the laser and the patient's willingness to have downtime.
So those are all great to discuss during a consultation. All right, this is interesting too. Everyone's been submitting anonymous, but this one's not. It's from Wendy. Do devices like Thermitite and Ultherapy improve the quality of the skin while they're tightening it?
Do Ultherapy and
Thermitite
improve the quality of skin? Absolutely. In fact, even some fillers have been shown to improve the quality of skin. Sculptra, which is not a true filler, but what I call a seed, to help stimulate collagen production. But fillers also have been shown to improve the quality of skin. And I see it all the time with Thermitite, with Ultherapy, with Thermage.
All right, a few questions now about more the lip area. So we'll start with this one. What is the best for the wrinkles above the lip?
You know, if you look at the most aggressive treatments for that, carbon dioxide laser when it was fully ablative, not fractional, dermabrasion, which is a wire wheel or a diamond wheel spun at 25,000 RPMs, abrading the skin surface, and also the deep chemical peel. People will get significant improvement with the wrinkles, but it's not forever, because we are speaking, we are eating, we are moving the lip muscle, corrugating the skin above it, and it just forms new creases. So with someone with significant photo damage and a smoker in the past, we're probably going to need to do those treatments, but again, not everyone wants a downtime. And whereas in my practice, I'm not speaking for all physicians, those lines, the smoker's lines, were often treated with a filler injected vertically right underneath each line. And often this is done in women who notice that their lipstick bleeds up into the creases. However, in the last several years, by taking filler, whether it's Restylane or Juvederm, I prefer personally Juvederm around the lip area, and diluting with some anesthetic, this is off-label, I can inject it horizontally by basically doing a hyaluronic acid plumping effect. We're giving back the dermis the hyaluronic acid that it's lost over time. That's a natural product, and that's what Juvederm and Restylane are, as well as other fillers. And that has produced, without bulking up the lip, without making a duct lip, softening of those lines. And then there are times that I top it off with other fillers. There's superficial fillers, such as Bellotero, that can go on top of the other fillers and improve the superficial face.
Okay, so again about lips, this Jenny says, what about lips and above the lips, which will not make one have an appearance of duck lips? So CO2 lasers, is that the best? Who's the best candidate for the CO2 lasers?
Someone needs to have, in my mind, significant wrinkling of skin to undergo the CO2 laser, or lengthening. As we age and we lose the bone mass where the teeth are in the maxilla up here, things recede and then the lip falls, and again, loss of elasticity. So if we're not talking about the red vermilion lip, but what we call the skin cutaneous upper lip, we can do fractional carbon dioxide laser to induce some shrinkage of tissue and lifting, and certainly not making a duct lip. You can inject some filler very judiciously in the area up here to help lift the upper lip as well, and a little bit inside the vermilion border, close to the vermilion, to help lift up, again, without a duct lip.
Okay, so then this is the last one about lips. So what is the best treatment, I guess your favorite filler, to plump up and reshape the lips?
I personally like Juvederm. I know there are a lot of other fillers out there, a lot of new fillers, and I might change my vote in a year trying some other fillers. There are newer fillers that may not induce that little bit of plumping that occurs within that day after the filler is done, and that might be nicer to use, but I don't have that experience myself. I like Juvederm more than Restylane in the lip. I like Restylane more than Juvederm in the tear trough below the eyelid, but for the softness, I like it in the lip.
Okay, so this might be a question lots of people are thinking. Are there any topical treatments like serums or creams that can improve skin elasticity?
So I mentioned Elastin. I think there's a lot of science with that company. It was in one of the earlier slides. Elastin spelled with an A helps our elastin with an E, but it helps collagen too. And again, what we have found is it helps remove the damaged elastin prior to helping stimulate new elastin, and that is something that can help our patients get better improvement. If we're trying to generate new collagen and new elastin with heat with these devices, and they've primed themselves by using something such as elastin, possibly these other products like Skin Better Science, then they might get more collagen and more elastin from the procedure.
Great, okay. Here's a good question. Are you currently seeing live patients and doing procedures right now in view of COVID?
Yes, we are. I have been practicing my skin cancer Mohs surgery throughout the COVID, but we are just starting now. We are certainly back full gear with 5 days a week, and our full staff is here, thankfully. We welcome them back. We've missed them, and we are doing cosmetic procedures.
Great. And here's another good one. When you believe that more than one treatment could give the best result, will you discuss a treatment plan's approximate overall cost to help the patient decide?
Yes, and this is where I think it is very important to have my patients be part of the team. I need to know their lifestyle, their desires, and again, not only am I cost conscious, but I'm convenience conscious. I don't want people coming innumerable times if we can combine procedures. So we make a plan and I lay it out. Okay, for this particular patient, they may want to do Ultherapy and then at a later date, thread lifting, and then we can do fillers, and then we can do lasers for the surface of the skin. Or we might only do 2 of those. And every patient sees me will then have a biller quote them to the penny what each of those procedures cost. We don't want anyone to guess. It is very, very difficult to do a televisit and determine exactly what you're going to do until we see someone in the office and we're putting our hands on their face, we're feeling the integrity of the skin and getting a 3-dimensional view. That is so key to this analysis.
Definitely. Okay, here's another good one. What do you recommend for hollowness under the eyes?
It depends where that hollowness is. And tear trough injections are commonly done with fillers. And it, again, depends on the physician and what filler it is. But unfortunately, some people have such a mound below what we call the tear trough or groove, and that accentuates this tear trough groove. If you are trying to erase the groove, you'd have to fill the groove so much that it's flush in the same plane with the mound that they have. They will look abnormal. And so there are some patients that have festoons, which is a fluid buildup. And we have found, whereas there hadn't been treatments, that we've had some good success with flattening festoons with the microneedling radiofrequency devices, the Genius and the Infinite. But in general, a good candidate for tear trough injections has flush skin, but just the groove in the tear trough. And we're using a filler. It might be Bellatero, it might be Restylane. Other doctors will use Juvederm. And we're usually placing that deep to lift the muscle and the skin above it.
Got it. Okay, let's see. What is your best treatment recommendation for tech neck?
This is such a problem. And the reason it's a problem is we had tech neck before tech. There are many patients that have horizontal creases in the neck, and it was initially said that Botox injected there would help. I haven't personally, in my patients, found that to be a great success. So we've done many different procedures, and now that tech, meaning looking at your phone with your head down, is forming the skin to constantly be in folds, we see a lot more of this. And with Zoom and other teleconferencing, people are seeing themselves in different angles and being aware of this. I have found that the microneedling helps, Ultherapy can help, Thermage can help, but Thermitite, which is that minimally invasive procedure, has helped me the most with tech neck. If it's a little bit of crepiness, laser resurfacing can help, but unfortunately, below the jawline, the skin of the neck is different than that of the face, and our energy levels that we use in lasers below the neck have to be downplayed for safety, and so the effectiveness may not be as good.
All right, let's see. This is from Phyllis. What can be done to the thin skin directly under the eyes to reduce wrinkles?
Laser resurfacing is my predominant choice for that. And that would be usually either the non-ablative fractional Fraxel laser, the Fraxel Dual, otherwise called Fraxel Restore. But when the crepiness is more significant, then we would have to do either fractional carbon dioxide or fully ablative programming.
Got it. Okay, here's a good question. What about saggy earlobes and stretched holes?
Well, depending on the length of the stretched hole, often that needs to be surgically repaired. For sagging the earlobes, fillers work quite well as long as the earlobe isn't too saggy. But if someone has used extenders and gauges, unfortunately, that's beyond repair with fillers and lasers and would need a surgical correction.
Okay. How long did the
Let me add that with laser resurfacing on the earlobes, we can induce some tightening, and many times earlobes are forgotten by patients and some doctors when doing full face resurfacing.
how long do Thermite results last?
Thermite I've seen last for several years, but you know it's a different type of ball game. It could be 2 to 5, I would say, is a good range for an average result.
Next question. I recall in an earlier webinar, the doctor did not feel Ultherapy did a lot for older patients. Do you agree?
I do agree. I absolutely agree. I think I showed one picture of a neck that got better results with a certain treatment. Sometimes there are wins, but in elderly patients, you know, I'm talking the 80s, I'm probably talking mid 70s, and again, smoking has another factor, the sun damage severity. We're not going to get as much tightening, for sure.
Is Ultherapy very painful?
There are different energy levels that the provider can choose, and the device was then remanufactured with this option to use a lower energy setting, but more lines of treatment to make it more comfortable. But giving our patients adjunctive medication, painkillers, anti-anxiety medication, laughing gas, what we call Pronox, that's the manufacturer for nitrous oxide, I'm typically able to give the higher energy.
Can you do Fraxel laser treatment on the upper lip only? And what would the downtime be?
We can absolutely do Fraxel repair on the upper lip only, but it does depend on the patient's coloration of skin. Because we want the cosmetic unit, which also involves the lower lip and chin, this whole area, to be kind of a match.
And so what's the downtime for that?
Downtime is absolutely somewhere between 8 to 11 days, could be 12, could be 7, depends on the person.
Okay. I think you've touched on this a little bit, but will Thermage help with wrinkles around the eye area?
Yes, it absolutely does. And it depends where around the eye and how close to the eye, because we can then also use Ultherapy, but Thermage can get closer to the actual eyelid margin.
Okay. We have about 5 questions left. So if anyone else wants to get in a question, please submit now. Just giving you an update. So let's see. What is the best way to address midline crepiness of the neck? Does anything work?
We mentioned before Infinity, Ultherapy, Thermage, microneedling. They all help. When we do Thermite and liposuction, we do get some tightening. It's interesting. Liposuction alone, I typically find some crepiness forming with someone who has a significant amount of submental fat. We get a lot of retraction, but there is that linear crepiness. And so that's an advantage of sometimes doing liposuction and Thermite. But you can certainly do Thermite after the liposuction, or you could do Ultherapy or microneedling, possibly laser resurfacing.
And that's why it's lovely to come to a practice with over 100 devices, so we can do a little bit of all. Okay, let's see. This is an easy one. How long do the results from Voluma last?
You know, the company has shown evidence that it can last up to 2 years, but the clinical result, there's going to be some, you know, tapering off. The volume goes down over time, but there are a lot of my patients that are seeing me at 1.5 years after Voluma, and they're only just starting to notice that little depression. And I do think that topping it off is better than just waiting for it all to deflate and do it again. I think it becomes more cost effective if you can get away with dividing one syringe between both cheeks and topping it off periodically, even if it's once a year. You're building maybe a little collagen while doing the filler. So let's augment that on an ongoing basis.
Great. So Jenny just asked if we can get a copy of these slides for some of us that are less versant in all these clinical solutions, and I can answer that. This webinar is being recorded and it will be sent out to everyone via email, the recording to view this weekend, but it is available now on Facebook because we were also streaming on Facebook Live. So you can use that recording and pause as much as you need to go back and reference the slides.
Yeah, I'm sure many of you have lots of other things to do, but if you are interested to review, please go to the website. But please keep this in mind. Every single patient's photograph here, except for the abdominal man, every photo were my patients, and they've given me and the practice the rights to display them. You do not have permission from my patients to use the pictures for your benefit by sharing them with other people, or certainly for cost. But definitely for your education, please review our webinars and socialize them. Let your friends see this.
Yes, thank you. How about lasers for the hands?
We do a lot of laser for sunspots. In terms of wrinkles, we do a fair amount of Fraxel Dual for the hands. Certainly, I have not done microneedling for the hand. The skin is thin. We also at times do fillers to hide the ropey veins underneath the skin.
Okay. Does Botox help in the neck help to prevent tech neck?
I do think that if someone were to embark upon a Botox series of treatments and maintain it through the years, that it can help. But it's only really helping those muscle bands. Some people have phrased baby Botox. We're using a very dilute amount and injecting it all over the area. I'm not so sure that I personally have read the articles that show that there's a significant improvement by doing that. Again, I think the jury's out.
All right. So we're going a little outside the face and the neck, but that's okay. Can you put filler around a small bone bump in the nose?
Absolutely. Some people call that a liquid rhinoplasty, a non-surgical nose job. And you can hide the fact that there's a bump there by filling the depression above it or below it. There are risks with fillers. There are serious risks with fillers. Fillers are done so commonly by so many people, so many providers around the world, but there have been, unfortunately, some very significant complications from filler, especially in the central face. So you have to be aware of that. You have to discuss in earnest with your physician before actually signing on the dotted line. What are the risks of that procedure?
Okay. Is there anything appropriate for both the face and the body? Maybe the Infini?
Well, Infini is certainly done on many body parts. You know, the crepiness of the skin above the knee. You can do it on the crepiness of the elbows, the abdomen. You know, after mommy makeovers, you still might have a little textural change like crepiness. And microneedling, Infini Genius can definitely help that. Again, Thermage can help that. I do a fair amount of body work, and again, I find that for me, things like Thermage and microneedling do provide benefit.
All right, last two questions. Which filler is best for the vertical lines between the brows?
Notice how I paused? Botox is the number 1, 2, and 3 treatments for the number 11, as we call it, those vertical lines. They're formed by the muscles constantly frowning. So when you put a filler there, you're still frowning. You may push the filler to the side. But more importantly, we mentioned complications before, midline face, and there have been complications with filler in this area. So it has to be judicious. It has to be by a very well-educated and experienced physician to know which is the filler. I'll tell you a little story. I had a long-term patient of mine who called me from Florida. She was so apologetic, but she was in a fit. She was down visiting her mother. She had been doing Botox with me in the past. And her mother said, honey, for your birthday, I'm treating you. You're coming to my doctor. So she went to her doctor, an oculoplastic surgeon. This was back in the days that we used collagen from cowhide rather than the hyaluronic acid fillers. And they did Botox as well as the thick filler. It plugged up the bloodstream in the forehead, and she developed a 2-inch diameter complication, which was an ulceration that had to heal. And then fortunately with lasers, I was able to treat her that it became not, it was inapparent at the 10-month period. But there can be even far worse complications. So we inject not thick, but thin fillers superficially. I like the Botox to work first to relax the muscles. And then if I need to do a filler, somebody might have an event in 6 weeks. And Botox doesn't work immediately for all patients. You freeze the muscle, and then with time and repeating the every 3.5 month to 4 month cycle, maintaining a relaxed state of the muscle, the creases start to relax. But you might want to top it off with a little filler to make it look softer for that event.
Very interesting. Okay, last question. I have fair skin with good texture. Can lasers or microneedling do more harm than good?
If someone came to me with nothing to treat, I'm not going to treat it. If they have minimal textural irregularity or minimal, let's say, sagging, sure, I would consider it. With things like microneedling with infrared, there are virtually no cases of post-inflammatory hyperpigmentation, but there will be some. And some people of dark skin color are more prone to post-inflammatory hyperpigmentation. We examine them and we see, oh, this little acne blemish had caused a brown spot from 3 years ago and it's still there. A mosquito bite on the leg, it's still brown after all these years. Or a little scratch on their arm. So we have to take that into account. But for projuvenation with skin that's not prone to post-inflammatory hyperpigmentation, if we want a little tightness, yes, I would consider that.
Okay, great. Well, thank you so much, everyone, for tuning in. Thank you so much for Dr. Shelton. I hope you all found this educational and informative. Again, this is recorded, so we will send you the recording via email, and you can also see it right now on Facebook. When we close down the webinar today, you will get a survey, and if you have any feedback to share, we would love to hear. This is still a little bit of a new webinar series for us, and we're always working to improve. But ultimately, we hope you found this educational, and whether you decide to come see Dr. Shelton or another doctor at the Laser Skin Surgery Center of New York or elsewhere, hopefully those will help you be more informed and to make the best decisions. Thank you, Dr. Shelton.
And thank you everyone who's attended, and especially for the long duration of your attention. It's been great, and we hope that we see you in the practice. Have a great night.